Welcome to SFLiberalBuzz. Thank you for tuning in. Freedom is a Constant Struggle was a great show. So, I really like that show. And today we're going to talk about the privatization of public housing and the usual Twitter feed and social justice issues that we like to cover, because those are the liberal issues, are social justice issues. So this is called Liberal Buzz because we're buzzing about it. And today, last week we were talking about, last month we were talking about the e-cigarette ban pending, and this is Elihu Hernandez to help me sort these things out. I didn't want to be in here alone talking to myself. I had to bring someone so I don't sound like I'm a nut, I'm talking to myself.
Well, I meant mainly macadamia nuts, right?
Okay, well, that's lovely. And so the ban is pending in LA and San Francisco, but Supervisor Eric Marr, isn't it?
Yes.
Supervisor Eric Marr was having second thoughts about it, and the cannabis won't be included. It won't be the cannabis vaporizers, just the nicotine vaporizers. We have a call. Hello, caller. You're on the air. Thanks for ringing up.
Okay, just as I called, I wanted to let you know there was no sound, but just as you answered, your sound came on. This is Tom. Just want to let you know you were talking with no sound.
Thank you, Tom.
Oh, incredible.
Right,
Thank you. Well, let's start all over again. Okay, Denise.
Welcome to SFLiberalBuzz. I'm Denise Dorey. This is Elihu Hernandez, my co-host, and we're here to talk about social justice issues of the day, and one of them is e-cigarettes.
And we'd like to thank Tom again for calling in and letting us know our sound was off. And as Denise was talking about, we're talking about the possible ban on e-cigarettes, which will not affect marijuana. Supervisor Eric Marr is proposing this new plan in the city. Of course, I have been tweeted and on Facebook and as to Supervisor Marr that if you don't like San Francisco, if you don't like fog, stay out of San Francisco. It's the exact same thing that comes out of the e-cigarettes. This is a non-toxic event.
Well, I don't know why people are put off by them either. I don't smoke e-cigarettes, and they don't satisfy me. If I was a smoker, I'd have to have the real thing. But,
one of the biggest arguments is that it's a marketing targeting toward youth. I have yet to see any advertising on billboards near any high schools or elementary schools.
Well, yeah, true that. And let's see, we have also a new bill in California Assembly, the primary physician. Do you want to talk about that, Eli? I can't
Yes.
read your writing.
There is a new bill proposing through the California Assembly that will allow only primary medical doctors to prescribe you your medical marijuana card, which means no other organizations such as Medican to go to organizations to get your medical marijuana card. And I see, Denise, we have a caller.
Yes, we do. I was letting you finish your sentence. Hello, welcome. Thank you for bringing up. Turn your TV down.
Oh, okay, just want to let you know we're not hearing anything. You're not broadcasting. I'm sorry, just want to let you know nothing's getting out.
Oh,
Okay.
all right. Here, you
All
go.
right,
You just keep on, and I'll tell them.
Okay, thank you, Tom. This is Tom again, correct? Okay, we'll try this again. Okay, Tom, if you cannot hear me, please call in again. Of course, it doesn't work, right? We were discussing the new possible legislation. We was talking about the new legislation about the California Assembly, and we had a caller here. Tom called in twice and said that there was no sound coming through our system, only when the phone was activated. So right now we have a technician here trying to fix this. It should be working correctly?
Yes.
Okay, if you can hear me, you can call in 415-861-6648, just like Tom did. To get back to the new proposed bill, this will allow only primary physicians to issue your medical marijuana card, which means that other organizations such as Medican cannot no longer issue your cards, which I feel this is a very positive step toward regulating marijuana itself. A personal pet peeve of mine is actually when the news programs happen to show when marijuana is legal, and you see people just kicking back, smoking 2 joints, smoking a bowl, or in the public with their friends laughing. This is a behavioral issue that many psychologists describe as a drug behavioral problem, as a sign for drug behavioral problem. This can help actually eliminate many drug seekers, people who are actually seeking to fulfill a drug need. Because if people are actually trying to fulfill a drug need for prescription pills, they would have to go to a doctor and describe their pain every few months. Right now in the current legislation, in order to obtain the medical marijuana card, you'll need to see your doctor once a year.
Let's see if it's on here.
And we have Denise back in here, and our technician told us that the sound is correctly working.
It
If
is?
not, Tom probably would have called back in.
Did he come back?
The technician did come back in, he said the sound is working.
Okay.
And I'm sure if it was not working, our caller Tom would have called back in and said,
Well, I'm gonna have
he
to
has no
edit
sound.
this. This will have to be edited, so I'll just edit it with my camera.
I see the sound register there, so.
Oh, that's
I was
right.
just
That's
discussing
good.
about the new proposed bill here, about the possible primary physician being the only one to issue a medical marijuana card.
So, how do you feel about that? Do you think that,
I've already explained my opinion that this could be a positive effect to eliminate many people seeking to use drugs, such as prescription drugs. It's another alternative to actually support the drug habits. I believe it's a good thing to limit this to people actually need medical marijuana, not just somebody who says, yes, I have a migraine every once in a while, but over-the-counter aspirin does help. Okay, granted, there are patients who say, I have severe liver problems that I cannot digest actual pills. There are some cancer patients which pills do not actually help them. Medical marijuana is actually proven, past 43 years, that it's actually a pain relief. It helps cancer patients, it helps blood patients, it helps leukemia patients, it helps people with chronic migraines, it helps people with chronic muscle spasms, such as myself.
let's see, I was going to go down the Twitter feed real fast. I did set, on Facebook, I did put the word out for people to call in about how cannabis helps them. Because Jerry Brown, I was gonna say on the Twitter feed, Jerry Brown is talking trash about us a little bit. He might be trying, do you think he's trying to appease the conservatives by, well, you'll see what I said in Twitter.
It's very interesting that a governor with the nickname Moonbeam is against legalization of marijuana.
Well, here we go. Let's get to this Twitter feed for a second. The Wi-Fi surveillance in Seattle, Washington was dismantled after public outcry. And so that means that people saw white boxes and were saying, we don't want, those are for surveillance. They sussed it out, and so Oakland followed suit with that. So Oakland now, they only surveil the ports and the main bus stops, bus stations.
Because
And the
Mayor
train
Kwan
station.
finally adhered to the public's cry. She was elected to represent and listen to the people of Oakland, and she actually finally listened to the people. They said, do not survey us. We will be targeted. And
Chris
she actually
Christie.
agreed and said, okay, we'll do the ports for security, for safety of the city.
Chris Christie admitted the GOP is fighting for the Koch brothers at CPAC. So he came out and admitted it.
Who else is not fighting for the Koch brothers? Come on.
How can they deny it? Housing authority known as Plaza East was already sold to a private housing corporation partly owned by Goldman Sachs.
Oh my
They're
gosh, public
privatizing.
housing wants to be privatized?
They are already.
Oh, there are so many problems with public housing nowadays. I mean, on Facebook today, my friend, who happens to be living in Mission Housing, he has a problem with cockroaches. I'm not going to say his name for anonymity problems, but he talked to his property manager, and it's very interesting because the property manager told him basically that he believes one of the tenants is bringing them in and setting them free in the building and possibly breeding them in their room. This is a response from a property manager from Mission Housing. I believe the correct response would have been write a report, file with my authority, with my supervisor, and we'll get your place inspected and fumigated. This is the right response, not, yeah, I believe the tenant's growing roaches in our own apartment and setting them free in the building. If the manager believes that, then isn't there a certain possible eviction processes that can happen for the safety of the other tenants in that building?
Yeah, the housing authority they're trying to make it look like that the public housing can't afford to fix it. So they're going to privatize it, saying, oh, only the private donors have money, so they have to privatize it.
Maybe these people who are actually saying there is no money available in the state of California does not even listen to Governor Brown, because he recently stated in the budget proposal 2014 to 2015 fiscal year that there's at least $5.6 billion in revenue. Granted, most of that is going to go to subsidized schools and colleges, but shouldn't some of that money be set aside for public housing?
It should. And so now we get on to the rest. We've got Sanjay Gupta doubling down on medical marijuana, so he's basically telling the federal authorities that cannabis should be used more as medicine than a lot of pharmaceutical drugs. So,
Do you know, Denise, I want to backtrack back to the public housing issue.
yeah, I'm getting through the Twitter feed, and we will.
Okay.
Feds give big bucks for innovative public housing plan. That's part of it. That's one of the articles I read about it. So the for the innovative public housing plan, they want to have mixed use. So mixed, like some market rate, some.
You mean they want to set a certain percentage aside for market
Right,
rate,
right.
low income rates,
Yes.
as city charter states?
Yes, and the Russia Today anchor quits live on the air over Russian invasion of Ukraine because that's her home country, I suppose. That was the reason she gave in the article I read. Activists say San Francisco is trying to wash away the homeless. I've seen it, and
Unfortunately, this is an ongoing problem since Mayor Willie Brown and Mayor Art Agnew.
well, they used to ship them down to Santa Clara County. They used to ship them down to Westfield Mall in Santa Clara County.
Hang on a second, Denise. Denise, to go back to the washing away the homeless, if anybody wants to go to YouTube, you can actually YouTube the search bar San Francisco washing homeless. You can actually see videos of San Francisco Department of Public Works vehicles spraying people who are sleeping on the sidewalks. They're purposely raising their water cannons onto the sidewalks and purposely spraying them, then going back to the streets. These videos are available on YouTube.
I've seen them. I've seen it actually happen, so I just...
Carol Lee, what a wonderful woman.
We had Carol Lee at our dinner. She brought Girl Scout cookies, and she was in Time magazine with a story about Girl Scout cookies at the outside dispensary. So there she showed up at our dinner and brought us cookies too.
Marketing genius.
Well, I give flyers out to the Glide line, and we feed them each month. So then, let's see what else. There's a few more stories to get to, but I suppose that concludes the Twitter. So if you care to give us a follow, I'll give you a follow back at Denise Dorey on Twitter. So, and that's SFLiberalBuzz is the hashtag. So we like to answer your tweets anytime or get your input.
If you still want to call in, the phone number is 415-861-6648.
So we wanted to talk about how black men are being criminalized in the housing authority building, especially in the Fillmore. They're evicting brown and black youth and families to make room for RAD. Now RAD is the housing authority represented by Ellis Act eviction lawyers Bornstein and Bornstein criminalize black and brown youth and evicts families from public housing buildings to get ready for their new program. This woman, Sabrina Carter, says they criminalized her son so they could evict her family. She's a single mother and resident of public housing building Plaza East in the increasingly gentrified Fillmore district of San Francisco. So and this has been happening all over the country. They've privatized public housing. In this case of Sabrina Carter's family, she was harassed and intimidated by the law firm representing her public housing building. The infamous Bornstein and Bornstein eviction lawyers of San Francisco's Ellis Act eviction boom, who teach classes to landlords on how to evict their grandmas. That's in quotations. Mm-hmm. And she's jumped through every hoop, Miss Carter, she's jumped through every hoop to comply with the stipulation and exhausted every resource to get intervention for her son. she's forced to sign a stay away, for him to sign a stay away order. He can't go home to see his family, and this is over trivial things. They just follow, you know, you can't go home while being black, I suppose, without problems up there. So, you know, you see something happening to a brother, take videos.
Anybody, no matter what the skin color is.
Yeah. Yeah, despite all she's done, now they face homelessness, her and her two younger sons, through the criminalization of her children. And this has happened to 5 families in that building so far.
This article is brought to you by Poor News Magazine,
Yes.
Poor News Network Magazine, care of Tiny Lisa Gray Garcia. Thank you, Tiny.
What sort of a press release, too? Oh, I got a call.
Hello, caller. Please turn on your television. Thank you. Yes, please go. Hello.
Greetings.
Oh, hello. This is Tom again. Talking about public housing, I understand that you can be evicted or it's not permitted to have medical marijuana in public housing. Most of them are federal, so they don't allow. I had, actually, she was a member of our group, Marine. She was in public housing and then, or not public housing, but government housing. And she wasn't allowed to smoke, even though she needed it desperately for her medicine. So I just want to ask about that.
There are certain legalities to that law. I do currently live in public housing myself, and there are several tenants in my building who are medical marijuana patients. The property management stipulated if you actually prove a copy of your driver's license or ID along with your card that says you can actually use it or grow, as long as it's on file, they cannot be held liable if the police happen to make an unscheduled raid, or because police do happen to have a habit of making an unscheduled raid in unscheduled units without the valid unit number. Basically, as long as the property management is aware of it, this should be okay. And I would actually advise to anybody who's living in public housing to have a conversation with the property manager itself to find the legalities of this. And if you have any other problems, you can always talk to the Lawyers Committee on Civil Rights.
Great, thank you.
You're welcome, Tom. And speaking of public housing, unfortunately there's no 2014 update here. RAP, an organization in San Francisco called Western Regional Advocacy Project, came out with a book called Without Housing. It's called Without Housing here. To sum up this page, this booklet right here, it shows how since the Reagan administration has majorly decreased the funding and reduced building housing itself. I'm going to show you a little graph here, for example. The number of housing created since 1976. As you can see, probably not, as you can see right here, this graph has really gone down. See? Look at this.
Yeah,
This
it peaked out around what? It peaked around 1977.
93. This is the first, when Clinton started. And, of course, we also have the budget outlays. Unfortunately, I should have pulled this up on the website so you can see. This green line right here is the number of public housing development that was created in 1977. And it just totally dropped and has been steady, which means no new housing units have been built. Of course, thanks to Mr. Paul Bowden, who is the executive director of RAP, came up with a comparison of federal funding priorities. I say priorities. In 2008, the constant dollar millions, the highest priority was the one Zumwalt class destroyer, which cost an estimated $4.1 million. How much was spent in the rural and public housing? 17,000. 170,000 approximately. As you can see, the lowest part of housing that was built, funding with the public housing. Everything else, military increasing. Virginia class attack submarine. Let's see, we do have public housing capital expenses, which goes for salaries. And we also have the San Action amphibious assault ship. Wait, these are all military projects. Do people actually live on military housing, military projects, military ships and submarines?
It's for the military.
Ah.
A parallel government.
If you want to find out more information, you can go to raphome.org. That's WRAP home.org.
We have different housing for military and civilians.
Yes. And we're now at our 2-minute wrap-up point.
So we have actually SEIU, they're marching on City Hall on Wednesday the 19th, 2014 at 12 noon to 1 p.m. And to wear purple to show your support for the workers, Local 1021. Our next action will focus on taking our demands to City Hall. We are demanding that the mayor prioritize addressing our demands, such as provide for the needs of our community, provide affordable health care for all, stop privatization of agencies such as a housing authority and redevelopment agency, 40-hour work week for all museum workers, stop the abuse of part-time workers as needed workers, living wage for all workers. I think it should be more than $10, I do. Reinstate alternate work schedules, end the abuse of eligibility workers at HSA, help better and safer staffing and protection against de-skilling. So these are all things, it's an important rally for the workers, and the city continues to give hundreds of millions of dollars in tax break to big corporations while refusing to address our needs for affordable health care, reasonable workloads, wages that keep up with inflation, and the abuse of part-time and as-needed workers who get no rights at all. You just can't even get your teeth for. I can't understand how people who work with our food shouldn't have health care.
I totally agree. I used to be working in the restaurant industry myself, and it's very imperative that if you actually have health care, because you wouldn't want to have somebody serving your food who's sneezing or who has the sniffles, right? No, you want to actually make sure you get the proper medical health care itself.
Yes, you want them feeling good, and when they feel good, they actually perform better.